Hello dear students, welcome to Genesis. In today's lecture, I am mainly going to cover the different defects of human eye and what is stereoscopic vision. Remember one thing, your eyes are very precious organ. So you must take care of these and you must also remain aware about what are the different kind of defects that can arise in your eyes. Number one is the myopia. Myopia, also known as near or short-sightedness. That means in this condition you will be comfortably seeing things which are near. So the near objects are clear, but the far objects appear to be blur. Now here the image of the object is formed not on the retina but in front of the retina. This is the defect, and that is why you find difficulty in observing objects which are far. Now the cause can be two. One is the eyeball is lengthened from the front to back. So if this is the eyeball, imagine if it becomes like this, it becomes lengthened from front to back. Second, the lens can be too curved. Under such conditions you will have this defect, but this can be easily corrected by use of a concave or a diverging lens, as a result of which now the image will form directly on the retina. This is a very common defect that we see, and people who suffer from this defect have power which is denoted as negative power. Now right opposite of this condition is hyperopia, which is also known as far or long-sightedness. Under such condition you have severe difficulty in doing anything which is close to your eyes, like reading or maybe threading a needle. So you have difficulty seeing nearby objects. And why? Because here the image is not formed on the retina but it is formed behind the retina. Here it is formed in front of retina, here it is formed behind the retina. And people with such difficulty have power denoted as positive power. Now what could be the causes for this? The first cause is shortening of the eyeball, and second is the lens now becomes too flat instead of becoming curved. Like in this condition it is too curved, here it is too flat. This can again be easily corrected by using a convex lens. Two diagrams, basically I am giving you two situations and I want you to guess the condition of the eye. See, in the first case very clearly the image is formed before the retina or in front of the retina. So what is this condition of eye defect called? This is known as myopia. And then you may be asked that how can you correct this condition? We can correct this condition by just using a diverging lens, or which is also known as a concave lens. In the second condition, the image is formed behind the retina. So this is a condition of hyperopia, and for correcting this condition we are going to use a converging lens, also known as a convex lens. Okay, now let us discuss the third defect of human eye. It is known as astigmatism. Now in this the problem is that some part of an object are seen in focus while the other parts appear blurred. So when you are asked to observe any object, आप जितना भी कोशिश कर लेंगे उस object के कुछ parts they are going to be very clear, बहुत अच्छी तरह से समझ में आएगा, whereas उसके आसपास के एरिया blur दिख सकते हैं. अगर ऐसा है then you are suffering from astigmatism. ऐसा क्यों होता है? Because of the uneven curvature of the cornea. और ऐसे patients के लिए यूज किया जाता है सिलिंड्रिकल लेंस. The next defect is presbyopia. ये एल्डरली लोगों में देखा जाता है. It is very similar to the condition जहां आपको पास की चीजें अच्छी नहीं दिखती. They cannot see the objects which are near clearly. क्यों ऐसा होता है? Because with time lens अपनी flexibility lose करता है with age. इसके लिए होता है, and this can be corrected by using a convex lens. Next one is cataract. We are all aware of it. ये एल्डरली लोगों को बहुत कॉमन हम लोग देखते हैं. Now इसमें the vision is cut down and the person can even become blind. उन्हें कुछ नहीं दिखाई दे सकता है. Why? Because the lens turns opaque. We all know our lens is transparent, right? When it turns opaque, that is when you suffer from cataract. ऐसे conditions में या तो इस patient को एक convex lens का spectacle दिया जाएगा, और into आजकल with advanced technologies what we do, we remove that old lens and implant a new plastic lens. Type of eye defect is night blindness. नाम से ही समझ में आ रहा है. Such people will have difficulty in observing things in dim light. Now why does this happen? This is because dim light के लिए we need rhodopsin pigments. In such patients there is non-formation of rhodopsin pigment. And why does this happen? Because of vitamin A deficiency. Vitamin A is very important for the formation of rhodopsin pigment. So if the diet is insufficient of vitamin A, then such people may suffer from night blindness. So what is recommended? They will be recommended a diet rich in vitamin A. A. The next one is color blindness. In such patients, they find difficulty in discriminating between different colors, especially between red and green. This is a genetic defect. So since it's a genetic defect, that means it is getting passed from the previous generation to the next generation, and there is a pattern in which this defect is passed. This kind of defect affect male more than female. So you already know that there are certain defects which are passed from one generation to another, and they have this typical trend of affecting male more than female. So defects are those that are usually linked with the X chromosome. So color blindness is one such example. We don't have any cure for this. The next is the corneal opacity. Opacity means opaque. That means here the cornea becomes opaque, as a result of which the person may have vision problem or may be absolutely blind. But we are lucky and fortunate that we can really overcome this situation by replacing the defective cornea by healthy cornea. Healthy cornea from the donor. So many people who are who are generous enough, they go and ask people to give their cornea after their death. So they basically donate it. So their death, the cornea is taken out from their eye and it is used to provide vision to people who specially suffer from corneal opacity. The last one is squint. Squint, people who are squint have problems with vision. They usually suffer from double vision. Why is this? Because the eyeballs, the two eyes, they converge. They converge, as a result of which the vision becomes blurred or double. This can be again treated by a surgery or by simple exercises that also can give relief to the patient. Okay, now we have come to the last part of today's lecture, which is stereoscopic vision or binocular vision. देखो, there are two kinds of organisms. Okay, कुछ के पास monocular vision होता है and some of us have binocular vision. Monocular vision जैसे lizard हो, rabbit हो, and binocular vision जैसे monkey and human. Binocular vision is way better than monocular vision because यहाँ हम 3D effects में object को देख पाते हैं. So you basically can perceive the depth of the object as well as its relative distance. ये बेचारे lizard and rabbits नहीं कर पाते हैं. Now if you have stereoscopic vision, इसका मतलब ये it is a power that you have. And how is this possible that you can assess the depth of an object or the distance? Because the object is focused on both of the eyes, both of your eyes simultaneously, and दोनों आंखों में जो image बनता है, they overlap in the brain, thereby giving a 3D effect. इसे कहा जाता है stereoscopic vision. Monocular vision में 3D image नहीं होता है, so they find difficult in assessing the depth of the object. So with this we finished this lecture. अब हम लोग next मिलने वाले हैं, where we are going to discuss the structure and the functioning of human ear. Keep revising and do not forget to subscribe my channel. Thank you.